Hello, I'm Kirsten Davidson, Professional Lead for Occupational Therapy Mental Health for Powys Teaching HB Board. I've been invited to share the virtual learning opportunity I'm developing on physical health and mental health as a holistic approach. This is a 10-minute presentation. Today, I want to share the inspiration and philosophy behind the training and the opportunity the training will provide to champion the role of occupational therapy within the mental health pathways in Powys Teaching HB Board. The training was inspired initially from observations I made from anonymised investigations and complaints presented to the Learning and Development Group. I noticed a subtle pattern of physical health issues were described but were not followed up. These physical health issues appeared to link to loss of function or difficulties functioning for the person in their environments. The investigations all revolved around deterioration in mental health and sometimes had catastrophic consequences. Loss of function from physical issues as a contributor to deteriorating mental health was obvious to me as an occupational therapist, and yet was not obvious to my mental health colleagues in the greater multidisciplinary team. I was asked to present the physical health needs of mental health service users in the next Learning and Development meeting. I presented the initial PowerPoint to the Learning and Development Group and was asked to roll out the training to staff in all mental health teams across Powys and to the Commission Services for Alcohol and Substance Misuse. The training is designed for the multidisciplinary team to encourage learning and reflection based on national strategy, statistics and the holistic approach embedded in the Mental Health Care and Treatment Plan, which is a legal right to all service users receiving treatment from secondary mental health services. The training also invites staff to describe mental health symptoms of mental health presentations. Physical health, mental health symptoms of mental health presentations, mental health symptoms of physical health presentations, and the physical side effects of medications used in the treatment of mental health. The groundwork will open up the training to explore the impact of physical health issues and the possible loss or change in function, in roles, independence, relationships, performance of skills, occupations and activities, and view of self. Function and loss of function and occupations is OT bread and butter. A deeper assessment of function and occupational performance by an OT after the initial care and treatment assessment is part of the CTP assessment if referral is made. To work as a multidisciplinary team using the holistic approach as legally required by the mental health measures, the multidisciplinary team members work to their speciality. At present, qualified staff often feel they are working as generic mental health workers and undertaking risk assessments and filling paperwork. The Powys OT assessment for mental health assesses environment, roles, motivation, volition in the areas of health, of physical and mental health, self-care, productivity through the question, what matters to you? Goals are created from this and reviewed within a determined time frame. As a service, we are building further training for all occupational therapists to be trained to use LACLs, which is especially important in assessment of older persons' memory function. We've introduced recovery through activity on the adult acute ward as a group programme to assess and build skills in self-management of all areas of daily activity and plan to roll it out to adult CMHTs. The All Wales Mental Health OT Network are working together to create parity of standardised OT assessments used across health boards in Wales to strengthen the value and identity of occupational therapy within mental health. The learning session highlights the dual training of occupational therapists in physical and mental health. It describes the role of OT in assessing physical health and loss of function and our ability to carry out assessment and intervention of environment, self-care, work. Mental health OTs can initially assess and order assistive technology and equipment and adaptations to the home or work. If it's more complex, we liaise with our specialist counterparts and refer to do a joint visit. OT is skilled in working through group work or one-to-one sessions for mental health service users experiencing physical health issues which impact on their function as part of working through the service user's primary mental health issues. The risks of service users experiencing loss of function or occupations or roles in areas of their day-to-day living following physical health issues may include disengagement from services, dependency on services, deterioration in self-care, self-isolation, deterioration in mental health, substance misuse or alcohol misuse, loss of motivation, hopelessness. As occupational therapists, we can champion this area through assessment and individualised treatment plans, as individuals will present in different individual ways, and different people have different coping mechanisms. So we cannot predict how one person adapts to changes to their physical health function without assessing and asking what matters to them. The importance of assessing and monitoring physical health is embedded in the CTP process, and it is a multidisciplinary approach. Being curious, noticing changes to routine or pain and physical presentation are all part of each mental health practitioner's role, involving the service user, the family, carers, other staff, providing consent is given, as what provides a broader picture. Involving the mental health medical staff and GP is important. Referral to OT for assessment of function and impact on daily occupations can be missed as staff focus on mental health presentations, which may escalate from loss of function. The training aims to bring the connection of loss of function as a big contributing factor to deterioration in mental health. The training aims to champion the strength of the MDT and the skill mix in assessing the physical health needs of mental health service users, rather than the current situation where care coordinators often hold all aspects of the service user's health needs, including physical, with input mostly from the psychiatrist and GP. The training has created an opportunity to highlight the connection of function with mental health and physical health. The two areas of health are intrinsically linked and will impact on our roles, occupations and function. Through highlighting the enormity of the CTP and role of care coordinator, the training acknowledges the difficulties and barriers to assessing physical health of service users for mental health workers and care coordinators. In Powys, service users are often admitted into different hospitals out of county and across the border into England. Multi-agency working can be hard to follow up, particularly if it involves in different borders and record systems. The balance of responsibility between physical and mental health providers and primary, secondary and tertiary care settings impacts. Different agreements for standard tests such as bloods and ECGs with different GP surgeries are present at present in Powys. And the access to face-to-face following CV-19 lockdown and fear of infection has impacted on time for service users with mental health teams. Deteriorating mental health can lead to disengagement and refusal to allow physical health assessment. The new way of working, where we use virtual formats and telephone appointments for assessments and follow-up, is positive but can make difficult physical health assessment, and it's more likely to be missed as staff focus on immediate mental health issues. The training reminds staff to keep physical health in mind and to actively ask each time they see a service user. Small changes can impact on function and lead to deteriorating mental health. It's easy to assume behavioural components, and knowledge of the complex interplay of physical health and mental health is central to good mental health provision of care. In Powys, we have the challenge of 12 qualified OT posts and 2 unqualified OT posts to cover 21 clinical team settings. The risk is the ability to assess and create a plan of care for service users who have lost function due to mental health and physical health being diluted as the occupational therapist works as a generic mental health practitioner. Opportunities which develop from this training are enhanced by the National Allied Health Professional Rehab movement in response to the ongoing CV-19 pandemic. The Allied Health Professional Rehab paper has galvanised us together and to work to the top of our licence. Within Powys, the mental health and physical OTs are working together to share best practice. The training also supports back to basics, provision of healthy eating, walking groups, groups connecting to nature and gardening. These have been the cornerstones of occupational therapy and have been outsourced to third sector. This is wonderful to provide integration into local community, yet the balance of groups in secondary services, structured interventions is also needed. We've run a twice weekly group with the Brecon Beacons National Park for 9 months. Members were able to access and build knowledge about their local environment and build skills. Many service users has lived with serious mental illness for years and have poor physical health from self-isolation, diet, smoking and medications. We saw marked improvement in physical stamina, weight loss and greater social interaction from service users. The group was co-run by OT and psychology. Self-rated well-being measures were taken at regular intervals. It provided another place to regularly assess physical health function. I hope the training will provide and promote true MDT working rather than generic mental health practitioners acting as care coordinators. I hope it will strengthen the OT mental health pathway across all the teams in Powys, and for mental health pathways for dietitians, physiotherapy and speech and language therapies to develop to ensure mental health service users can access physical health assessments and interventions in a timely way to protect their mental health and to protect their functional performance. By valuing each member of the MDT to contribute towards the assessment of service users' mental health and physical health, we're able to work together holistically rather than generically. Thank you very much for listening.